It's a funny thing about repetition. You've reached Talking with Dr. Terry, 180 seconds to a better you. Message number 38. I'm Dr. Terry Wurzbacher, and this call is dedicated to Chaz in California. I used to get so upset when I'd be teaching folks, thinking I was being so clear. I'd even be patient, and that's a relative term for me, and let them ask the same questions again and again and again. It's worth it, I thought, whatever it takes for them to get it. Then a week or more later, I'd be reviewing a case of theirs and scratch my head. What happened? They seemed to be paying attention. How could they screw this up so badly? Or when I was seeing patients in the ER, I'd explain what we were doing, and at the end I'd give them instructions. As they were getting dressed, I'd hear them ask the nurse or corpsman, "So what's wrong with me?" I used to take this personally because I felt it meant I was a poor communicator. As I grew older, however, and learned more about the application of the reticular activating system and the difficulties everyone seems to have with attention these days, I realized this was the new normal and I would have to change my ways. I also advocate in my book, Your Doctor Said What? Either taking notes or recording your conversation with your doc. There are cool apps now that will even transcribe the conversation. If you're going to use one of them, make sure you check the accuracy, especially since it will involve medical terms, and you should also let the person know that you're recording it. I also recommend taking someone in with you when you're going to the doctor. And here's why. And it applies to counseling students, children, clients, and athletes too, just about anyone. A patient has come to me for something unknown. They're worried and usually anxious. They want to know the diagnosis. Do I have some dreaded condition? Am I going to die? So a doctor can approach this in a couple of ways. They can give them the diagnosis first and then the instructions and then the plan of action. Or they can talk about the plan of action first and then the diagnosis. Which one is the best as far as comprehension is concerned? Neither. It's a slippery slope. All they care about right then is the diagnosis. If it's a strange one or a bad one, they won't hear the rest of what you're saying. If it's an okay one, then they probably won't hear much either because they're breathing a sigh of relief. Then their nervous system is in questioning mode. Is she sure? Why do I feel so bad then? Etc. So this is a difficult scenario given how little time medical professionals can spend with one client or patient. There needs to be an absorption period before you can go on to the next part. Take an athlete you're talking to. He's wondering if he'll make the team. You tell him no, but do you think he hears anything after the but? Not even if you're telling him that exactly what he can do to make the team, or that it's just a logistical thing for a few weeks. He only heard he didn't make the team. You'll have to repeat anything you think is important. You may need to do it in different ways and at different times. Don't we all learn best through repetition?